flexion, extended leg, to extension of opposite leg with right hip internal rotation and abduction. So if you passively bend your leg, the other leg is going to be extended and internally rotated and adducted. And then we have protective head turning. Some reflexes are considered remnants of evolution. We have a tonic grasp of hands and feet. It's just like the baby again. You ever put your finger around the baby's hand and the baby's automatically going to grasp onto it. Swimming is an amphibian motion. Oops. Do you need to write that down or anything? Okay. Reflexes produce stability, mobility, CNS development, and they regulate the degree, strength, balance, and distribution of muscle tone necessary for posture and movement. We have the primitive reflex, or those that appear during gestation or at birth and become integrated by 4 to 6 months of age. The rooting and the sucking are two of those. They are not considered pathological or abnormal because they are present in all full-term infants. And in a healthy baby, primitive reflexes are integrated with the first year of life. It occurs as the central nervous system matures and cortical control develops. Remember earlier on the slide it talked about the spinal cord, the midbrain. That's all related to the cortical development. Not all reflexes become integrated. An eye blink, a knee jerk, peristalsis. Reflex control is no longer dominant due to the development of motor control. However, the persistence of primitive reflexes would inhibit motor development, such as a tongue thrust, which you see a lot of people that have Down syndrome will have the tongue thrust at, at 30 years of age or 40 years of age, even still. Tonic grasp of hands and feet and flexor withdrawal. And reflexes are a strong indicator of your central nervous system development. Reflex testing is a tool for measuring cerebral spinal or central nervous system maturation. Reflexes group by the area of the brain which control them. And then this is another important slide to know. Spinal level, it has your phasic reflexes, which is your flexor withdrawal, your extensor thrust, and your cross extension. Your brainstem level relates to your tonic reflexes, your ATNR, your STNR, your TLR, which is asymmetrical tonic neck reflex, symmetrical tonic neck reflex. That's what the ATNR is. You'll learn these with Debbie. It's associated reactions, positive supporting reactions. Midbrain level, you have your writing actions, your neck writing on body, body writing on body, automatic movement reactions, Romero reflex, Landau reflex, palmar grasp, and plantar grasp. And then at cortical level, you have your equilibrium reactions, where you're prone, supine, kneeling, sitting, standing. So this would be a lower level of development, right? Do you see that? So it's going from lower to higher. important to know.
So the cortical level is the final phase, or like the highest phase.
And then the spinal level. It's observable movement in response to a touch, pressure, or movement of the body, or to a sight or sound received. Coordinate the muscles of the extremities and patterns of either total flexion or extension. And you have your brainstem level, your tonic reflex. Static, remember that term? Postural reflexes that affect changes in the distribution of muscle tone throughout the body, either in response to a change in head and body in space, or head in relation to the body. So the asymmetrical tonic neck reflexes, where your head is turned and your arm is, the opposite arm is moved in the opposite direction. Here at midbrain level, the writing reactions interact with each other and work toward establishment of normal head and body relationship in space, as well as in relation to each other. Combined actions enable a child to roll over, sit up, get on his hands and knees, and make him or her a quadruped creature. The crawling. Quadruped. I think that should be an A before the P there. Okay. Cortical level, you have your equilibrium reactions. They occur when muscle tone is normalized and provide body adaptation in response to change of the center of gravity in the body. Whoops.